Hello everyone. Today I am going to start unit on physiology of reproductive system. First thing, before going to explain the reproductive system, in the female reproduction, first thing is menstrual cycle. The menstrual cycle is the monthly series of changes that prepares the female reproductive system for the pregnancy. The menstrual cycle, it is the preparation, that is a monthly series. Here the hormonal changes will happen, and due to the hormonal changes, the reproductive system help the woman's uterus or the reproductive system will get prepared for the pregnancy. The duration will be 21 to 35 days average. The normal will be 28 days normal menstrual cycle. The menstrual cycle, it is a monthly series of changes that prepare the female reproductive system for the pregnancy. A typically cycle lasts about 21 to 35 days average. The normal days will be 28 days. The definition of the menstrual cycle: the menstrual cycle, it is the regular monthly physiological process in females in which hormonal changes prepare the uterus for the pregnancy, and if fertilization does not occur, the uterine lining is shades as menstrual bleeding. The menstrual cycle, it is a regular monthly cycle. Here the hormonal changes will happen. Due to hormonal changes, the reproductive system is going to get prepared for the pregnancy. If fertilization not happens, this menstrual cycle is going to happen. Next is the phases of menstrual cycle. There are the menstrual cycle is divided into 4 phases: menstrual phase, follicular phase, ovulation phase and luteal phase. In the menstrual phase, the first menstruation of first day to 5 days, we will call it as menstrual phase. First day to day of 5, we will call it as menstrual phase. Follicular phase means the day 5 of the menstruation to the 13th day, we will call it as follicular phase. Ovulation phase means around the 14th day of the ovulation phase, we will call it as 14th day of the menstruation, we will call it as ovulation phase. Then last one is luteal phase, the day 15 to day 28. The first 1 to 5 days, we will call it as first phase, that is menstrual phase. Then second, from the 5th day of the menstruation to the 13th day, we will call it as second phase, that is follicular phase. Then at the 14th day of the menstruation, we will call it as third phase, that is ovulation phase. And the last phase, from the 15th to 28 days of the ovulation, from 15 to 28 days of the menstruation, we will call it as fourth phase, that is luteal phase. Then first phase is menstruation phase or menstrual phase at the first day of the menstruation to 5th day. Here the uterus shades the inner lining. The inner lining of the uterus will get the inner lining of the uterus will get these shades, and the uterus, it results in the menstrual bleeding. At the if the fertilization not occurs, the menstruation phase is going to happen. Here the menstruation phase, it will shade the inner part of the uterus, that it is endometrium. The endometrium part will get shades, and it resulting in the menstrual bleeding. Here the hormonal changes. The hormonal changes in the menstrual phase includes the estrogen and the progesterone level is going to get low. The estrogen and the progesterone level is going to get low, and because there is no pregnancy, because there is no fertilization, so estrogen and progesterone level is going to get low. This estrogen and progesterone level will be high to develop the pregnancy. In the menstruation phase, there is no fertilization, so estrogen and progesterone hormones is going to get low. Next is in the phases of menstruation, which are all the clinical features will occur in the woman. At the time of menstruation cycle, bleeding will occur 3 to 5 days. The bleeding will occur in the 3 to 5 days. Maybe it may vary in the some women, that is 2 to 7 days it may get. Then It may be mild to moderate abdominal pain will be there, or abdominal cramps will be there. We will call it as dysmenorrhea. Sometimes some women may having fatigue, irritability in some women. Some women may having fever, body pain, and also the vomiting. These are all the clinical features or the symptoms which occurs in the phase of menstruation at the day 1 to 5. Next phase is follicular phase. This will start from the first day to 13th day. We will call it as follicular phase. Here in the follicular phase, the brain will get releases the FSH. FSH, it is a hormone, follicular stimulating hormone. It is going to get released by the brain at the day 1 to 13th of the follicular phase. Here several ovary follicles begin to grow, but only the one it's going to get mature. Here at the this phase, there will be a several ovaries going to get produced by the ovum is going to get produced by the ovary, but the one dominant follicle, one dominant ovum is going to get mature. That we will call it as egg, mature egg. That will happen in the follicular phase. Next, hormonal changes happen in the follicular phase. Which are all the hormones is going to get developed or going to get decreased here? That is, estrogen gradually increases in the follicular phase to develop the follicle to produce the mature egg. The estrogen is going to get increased. Then endometrium, the uterus inner lining is going to thickening. Here the endometrium of the uterus is going to get thickened in the follicular phase. Here at the day of 1st to 13th day, the brain is going to produce the FSH hormone, follicular stimulating hormone, and here in this phase there will be a several ovaries going to get produced, but only the one dominant ovum is going to get mature. And here which are all the hormones are going to get changed means the estrogen level will be gradually increases, and also the endometrium is going to get thickened. Next, changes in uterus at the which phase? Follicular phase. The changes in the uterus, endometrium lining become thicker and vascular. The endometrium inside the uterus lining is going to get thicker in the uterus. Which are all the symptoms is going to happen in this phase in the women's includes increasing energy and well-being. Here in this phase the woman will be well and energy will be increased, and cervical mucus becomes thin and slippery. The cervical mucus is going to get thin and also the slippery in this phase. Next is ovulation phase. The ovulation phase is around 14th day. The 14th day of menstruation, we will call it as ovulation phase. This is suddenly in this phase what are all the things are going to happen? Sudden urge of LH. LH is a luteinizing hormone. It helps to trigger the mature egg. The mature egg already prepared in the follicular phase. Here already matured egg is going to, the mature egg is prepared here. Here it is going to get, the mature egg will be prepared in the follicular phase. This phase is going to get here the sudden urge of luteinizing hormone. It helps to trigger that mature egg which is developed in the follicular phase, and this will enter the fallopian tube. Here the mature egg is going to enter the mature egg is going to enter the fallopian tube, which is released by the ovaries, that we will call it as mature egg, that is going to enter the fallopian tube. Here only the fertilization will happen. This mature egg will be enter in the fallopian tube of the in the ovulation phase. Next is, this egg survives for the 1 to 2 days. This egg, which egg enter the fallopian tube, will survive 1 or 2 days or 12 to 24 hours. Then In this phase, which are all the symptoms will occur in the woman? First one, mild lower abdominal pain in the some women. Some women will be having the abdominal pain and cervical mucus become clear and streaky like egg white. The cervical mucus is going to turn slightly rise in the body temperature after the ovulation. After the 14th day of the ovulation phase, the temperature of the woman is going to get increase. Next is last phase of the menstrual cycle, that is luteal phase. The luteal phase, it is the day of menstruation, the 15th day to 28 days of the menstrual cycle, we will call it as luteal phase. In this luteal phase, what all the things are going to happen? The ruptured follicles, the matured egg is going to become corpus luteum. It will be attaching the endometrium lining. The matured egg, we will call it as follicle, the ruptured follicle, the matured egg is going to attach the inner lining of the uterus, we will call it as corpus luteum. The corpus luteum is going to happen in the luteal phase. Corpus luteum secrete the progesterone hormone and sometimes estrogen. This corpus luteum, the mature egg will be attached in the uterus lining, we will call it as corpus luteum. This corpus luteum helps to produce the estrogen and sometimes estrogen and also the progesterone. Hormonal effect, due to the progesterone level increasing, what are all the things, what are all the effects is going to happen in the woman? Progesterone maintain the thickened uterine lining, we will call it as implantation. This process we will call it as implantation, which is ready for the pregnancy. The uterus is ready for the pregnancy, we will call it as implantation. If the fertilization is not happen, if the fertilization is not occurs, the corpus luteum degenerating hormone level fall. The estrogen and the progesterone level is going to get decrease if the fertilization is not happens. This things is happens in the luteal phase. Next is clinical features. In the luteal phase, what are all the symptoms is going to happen in the woman body? Includes post-menstrual cycle, post-menstrual symptoms. The post-menstrual symptoms may occur after the last phase, then bloating of the abdomen, breast tenderness, mood changes will happen, headache and irritability. These are all the symptoms may happen after the ovulation and the last phase. After the ovulation and also the last phase, these are all the symptoms may happen in the woman. Next is the functions and the hormones of the ovary. Before that, I will repeat the same things. First, the menstruation cycle, it is the monthly cycle, monthly series which happens in the woman. Due to this, there will be a hormonal imbalance, estrogen and the progesterone level will get down. Due to that, if the progesterone and estrogen level will be high, means it is going to get ready for the pregnancy. If fertilization is not occur, the menstruation cycle is going to happen. In this, there are the 4 phases. First one is menstrual phase. The menstrual phase will happen at the first day of the menstruation to 5th day, and the follicular phase is going to happen at the day 5th to 13th day of the menstrual cycle, and the ovulation phase at the 14th day of the menstruation, and also the day 15 to day 28 menstruation cycle, we will call it as luteal phase. Next, what are all the things in the menstrual phase, first phase of the menstrual cycle? Here the estrogen and the progesterone level is going to get the low. The estrogen and progesterone level will be low, and this is going to prepare the uterus for the pregnancy. These are all the phases of menstrual cycle. Next, I am going to Explain the hormones and its function. The functions and hormones of ovaries. First one, the ovaries. The ovaries are female reproductive organ that produce the egg. We will call it as ova. The production of the ova from the ovary, we will call it as produces the egg, we will call it as ova, and they secrete the hormone necessary for the reproduction and secondary sexual characteristics. The ovaries means the ovaries are the female reproductive organs. It is going to produce the egg, we will call it as ova. This ova or the egg, it is helps to secrete the hormone which is necessary for the pregnancy and also produces the secondary sexual characteristics. The function of this ovary, the function of the ovary helps to produce the ova. The oogenesis, we will call it as oogenesis. The production of the ova from the ovary, the process we will call it as oogenesis, and it also, the ovary also helps to regulate the menstrual cycle, support the pregnancy, development of the secondary sexual characteristics, and also the hormonal secretion. First thing, the ovary, it is the female reproductive organ. It helps to produce the ova or egg. This process we will call it as oogenesis. It is helps to produce or secrete the hormone and also helps to produce the or developing the secondary sexual characteristic. The function of ovary helps to produce the ova. The process we will call it as oogenesis. Then helps for the regulation of menstrual cycle, support the pregnancy and develop the secondary sexual characteristics and also the hormonal secretion. Next, which are all the hormones in the ovary? First one, estrogen. First one, estrogen. Second one, progesterone. Next, inhibin and relaxin. The estrogen will be produced, developing by the follicles. It is going to develop from the ovary, that we will call it as estrogen. Progesterone, corpus luteum after the ovulation. After the ovulation, the egg will be, the matured egg will be attached to the uterus, inner layer of the uterus, and prepared for the pregnancy, that we will call it as corpus luteum. Then inhibin, it will be developed from the ovary cell. It will be developed from the ovarian cell. And relaxin, the relaxin, it is a hormone which is produced at the time of during the pregnancy. It is developed from the corpus luteum and also the placenta. Placenta will be developed in the pregnancy. Due to the due to placenta or also the corpus luteum, this relaxin hormone is going to develop. These are all the hormones which will be present in the female reproductive organ, that is estrogen, progesterone, inhibin and relaxin. Relaxin will be present at the time of pregnancy. Next is, there are the terms which helps for the reproductive system. First one is oogenesis. I already said oogenesis means production of the ovum, production of the mature egg. Oogenesis, it is the process of formation, growth and also the mature of the female gamete. Female gamete means ova or eggs in the ovaries. In the ovaries, the ovum is going to produce this process, we will call it as oogenesis. Next is fertilization. Fertilization is the process in which a sperm, it is the male gamete, fuses with an ovum. Ovum, it is a female gamete. The male gamete sperm and the female gamete ovum is going to fuse and form the zygote, which process we will call it as fertilization. Next is implantation. Implantation, it is the process by which the fertilized egg, male gamete and female gamete, fuses and form the zygote. That fertilized egg attaches to the embryo or inner layer of the uterus, we will call it as endometrium. Uterine lining, it is going to attach, the fertilized egg is going to attach, we will call it as implantation. Here the uterus, here the fertilized egg will be there, that is going to attach the inner layer of the uterus, we will call it as implantation. this implantation will happen at the 6 to 10 days after the fertilization, after the fusing or after the formation of the zygote. The days from the 6 to 10 days after the fertilization or after the zygote, this process is going to happen. We will call it as implantation. Next is function of breast. The breast function, first thing we are going to understand what is breast. The breasts are accessory reproductive organs in the female that mainly function in lactation and also infant nourishment. For the infants and all infant nourishment and for the lactation, this secondary accessory reproductive organs are going to help. The functions of breast, first one, milk production, we will call it as lactation. Milk ejection, we will call it as let down reflex. After the delivery, milk is going to eject from the breast, that is a function. Second, third one, nutrition of the newborn, then immunity protection in the both infants and also in the mother. Then mother infant bonding is going to develop from the milk production and also the milk ejection. Then role in reproductive physiology. These are all the function is done by the breast. Next, these are all the things in female reproductive organ. Next we are going to move to the male reproductive system. Male reproductive system, okay. The male reproductive system is a group of the organ that are responsible for production of sperm, secretion of male hormones and also transfer the sperm to the female reproductive tract for the fertilization. The male reproductive system means it is a reproductive system. It helps, the group of the organs will be present in the reproductive system of the males. It helps for or responsible for production of the sperm and secretion of the male hormones and also to transferring the sperm into the female reproductive system for the fertilization. In this spermatogenesis, it is the process of production of the sperm. Spermatogenesis, it is the process of formation, growth and also the mature the sperm cell. We will call it as sperm. Sperm cell, it's called as sperm from the male germ cell in the tubes of testis. The production of the sperm from the testis, tubules of the testis, we will call it as spermatogenesis. This will happen in the male reproductive system. Next, which are all the hormones will be present in the male reproductive system and what are all their function? First one, testosterone will be present in the male reproductive system, then FSH, follicle stimulating hormone, then LH, luteinizing hormone, inhibin and also gonadotropin releasing hormone. First one, testosterone. This testosterone is going to produce from the, or we can identify the testosterone in the testis. The source of the testosterone is testis. Then follicular stimulating hormone, the source is anterior pituitary gland. The anterior pituitary gland is going to develop the FSH hormone. Next is anterior pituitary gland also going to produce the LH hormone. FSH and the LH hormone is going to produced by the anterior pituitary gland. Next is inhibin in the testis cell, it is going to produce. Then gonadotropin releasing hormone, it is going to produce by the hypothalamus. There are the 5 hormones which present in the male reproductive system. First one, testosterone released from the testis, FSH and the LH. Follicle stimulating hormone and the luteinizing hormone is going to produced by the anterior pituitary gland and inhibin is going to produce from the cell in the testis. Then gonadotropin releasing hormone is going to produced by the hypothalamus. These are all the hormones which present in the male reproductive system. Next, what are all the functions of these hormones? First one, the hormone is gonadotropin releasing hormone. This is going to produced by the hypothalamus. What is the function of this? Stimulates the FSH and LH. FSH, follicle stimulating hormone, LH, luteinizing hormone. This hormone is stimulated by the GnHR. Next is FSH, follicle stimulating hormone and the luteinizing hormone is going to produced by the anterior pituitary gland. FSH function is spermatogenesis, production of the sperm. LH, it is also produced by the anterior pituitary gland. It is the function is testosterone secretion. The testosterone hormone is secreted from the LH hormone. This testosterone produced from the testis, the function of testosterone is male character plus sperm production. The both sperm production and also maintaining the character of the male. Next is inhibin. It is going to produce from the ceratoil cell. The cells of the testis is going to produce the inhibin. The function of this hormone is control the FSH, control the follicle stimulating hormone. These are all the hormones and these are all the sources where these hormones are going to develop and also their function. Next, application and implementation in nursing care. In the reproductive system, the application and implementation in nursing care means carrying out of the planned nursing intervention to promote the reproductive health, support for the pregnancy, manage labor and also care for the reproductive diseases. We will call it as application and implementation. Intervention, planning the intervention and applying on the person, we will call it as application and implementation. In the reproductive system, we are going to plan the intervention to apply on the person to maintain the or implementation on the nursing care. It means it helps to promote the reproductive health, support the pregnancy and also managing the labor, care for the reproductive disorder. These are all the, this is the definition of application and implementation in nursing. Next, what are all the nursing implementation we can apply in the reproductive system? First one, antenatal care. At the time of pregnancy, we are going to give the care for the antenatal mother. That is one of the planned intervention for the pregnant woman. Next is an intranatal. At the time of labor, at the time of delivery, we are going to give the care. Then postnatal, after the delivery, which are all the care we are going to give. Then family planning and reproductive health disorder. Which are all the reproductive health disorders are going to be to control that or to prevent that, we are going to plan the intervention and applying on the person, either male or female. This we will call it as nursing implementation in the reproductive system. Once again, I am going to explain the male reproductive system. The male reproductive system, it is the group of the organs that are responsible for production of the sperm, secretion of the male hormone and also the transferring the sperm into the female reproductive system for the fertilization. The spermatogenesis means production of sperms. Spermatogenesis, it is the process of formation, growth and also the production of the mature sperm cell or sperm, we will call it as spermatogenesis. Which are all the hormones will be present in the male reproductive system include testosterone, FSH, LH, inhibin and GnRH. Testosterone will be produced from the testes, FSH, follicle stimulating hormone will be produced from the anterior pituitary gland, LH will be produced from the anterior pituitary gland. LH and the FSH both will be produced from the anterior pituitary gland. Inhibin will be produced from the cell in the testis. Then last one will be produced from the hypothalamus. And their function, GnHR function will be stimulate the FSH and the LH hormone. FSH and the LH will be produced from the both anterior pituitary glands. In FSH, it's going, the function of FSH is spermatogenesis, production of the sperm. Then LH hormone function is testosterone secretion. The testosterone function is male character plus female, male character plus sperm production. Next, inhibin is going to control the FSH. This is the both male and female reproductive system. I hope you all understand the class. Thanks for watching.